Welcome to E3 Rehab. I'm Mark Sertica, Doctor of Physical Therapy. Today we're going to talk about the reverse Nordic, how to set up, perform, and program the movement, why you should be using it to maximize strength and hypertrophy of your quads, and why it might be important to implement to reduce your risk of quad strains. Now, I do have a disclaimer. If you have pain with kneeling, if you lack full knee flexion or the ability to get your butt to your heels comfortably, or if you're generally just fearful of the movement, it might not be for you. Otherwise, it's a perfectly safe and effective exercise at targeting the quads. So let's quickly review the anatomy of the quads. There are four muscles. You have the vastus medialis on the inside of the thigh, the vastus lateralis on the outside of the thigh, the vastus intermedius, which is a little bit deeper, and then the rectus femoris, which lays over the top. All four of those quad muscles attach on the tibial tuberosity via the patellar tendon. However, those three vasti muscles originate on the thigh, whereas the rectus femoris actually originates up at the hip. So all four muscles extend the knee, but the rectus femoris also flexes the hip. So it has two actions compared to the other quads that just have the action of extending the knee. So we're going to focus on the rectus femoris muscle today and discuss two reasons you should be performing the reverse Nordic. Unlike the other vasti muscles, the rectus femoris doesn't contribute very much to compound movements like the squat that involves simultaneous hip and knee extension. Let's look at three studies that show this. The first study, by Emma et al. In 2016, titled Unique Activation of the Quadriceps femoris during single and multi-joint exercises, looked at muscle activation during simultaneous hip and knee extension, during the leg press, and during seated knee extension. The authors concluded that the study revealed that even at high intensity, the rectus femoris activation during multi-joint exercise is low and does not increase with fatigue. What this means is that the rectus femoris isn't very active during multi-joint exercises that involve simultaneous hip and knee extension, like the squat, the leg press, or for demonstration purposes here, something like the split squat, where I am extending my knee, but at the same time, I'm extending my hip. Vygotsky and Bryanton in 2016 looked at the relative muscle contributions to net joint moments in the barbell back squat. It was a modeling study that concluded the rectus femoris does not appear to contribute to the knee extension moment in the squat. The last study by Kubo et al. In 2019 looked at the effects of squat training with different depths on lower limb muscle volumes. What they did was assess the effects of 10 weeks of squat training on the muscle volume of the glutes, quads, adductors, and hamstring musculature. One of the main results of the study was that 10 weeks of full and half squat training increased the volumes of the vasti muscles, but not the rectus femoris. So, if you want to increase the strength and size of the rectus femoris, you need to perform a single joint knee extension exercise, either a seated knee extension, or in this case, the reverse Nordic. For the second reason why you should be performing the reverse Nordic, we can look to another study titled Rectus Femoris Muscle Injuries in Football, a clinically relevant review of mechanisms of injury, risk factors, and preventative strategies. Out of the quad muscles, the rectus femoris is the most commonly injured, and it has a high re-injury rate, up to 17%. It happens most commonly in kicking and sprinting, so in sports such as soccer. So the purpose of the reverse Nordic is to try to reduce your risk of this quad injury. We're going to talk more about this in just a bit. So now we're going to talk about how to set up and perform the reverse Nordic. Let's start with the feet because there's two ways we can do this. The first way is to tuck your toes underneath you, and the second way is to keep your feet flat. This is largely based on your preference and comfort. If you tuck your feet underneath you, you need to make sure that you have sufficient extension of the big toe and then it's not uncomfortable. If your feet are flat, you might feel a large stretch in the front of the ankle, and some people actually get cramping during the movement. For me, I prefer my feet flat. For your knee, you just want to make sure that you set up on a pad, a pillow, some towels, or some other soft surface. In terms of alignment of the rest of the body, you want to make sure that your knee, your hip, and your shoulder stay in a straight line throughout, meaning that you don't want to flex forward at the hips and you don't want your low back to arch. If you need to, you can perform a strong glute squeeze to set yourself up in a nice position for a straight line between your knee, hip, and shoulder. Now, there are 3 ways you can perform this movement: isotonically, or going through the full range of motion; isometrically, where you just hold that end position; or eccentrically, where you just lower yourself down and then restart. There are also ways to progress or regress the movement based on your needs. So let's start with the first one, isotonically. As I said, I'm gonna set up in this position. Now, if I want to make it easier, I can have my hands out in front of me to act as a counterweight, or I can hold the counterweight. I'm just gonna hold them down by my side. I'm gonna make sure that my shoulder, hip, and knee are in a nice straight position, and then I'm going to lean straight back, thinking about pushing my feet into the ground like I'm doing a leg extension, and then returning to the starting position. Now, if you're new to this movement, I would start off a little bit more conservatively by going to a shorter range of motion. As you get more comfortable, you can go further and further. To do it isometrically, all you would do is lean back and hold this position for a given time, say 20 to 30 seconds. Now, if you wanted to make either one of those more challenging, you would raise your arms overhead. That's going to make it harder for the quads and your abdominals to maintain that trunk position. So it would look like this. My preference would be to find a variation that works for you and focus on that. Think about quality, control, and range of motion before implementing any advanced techniques. Personally, I think the eccentric variation is the best way to perform the movement. Now, there are no published studies showing that eccentrics reduce the risk of quad strain. However, we're going to extrapolate data from the Nordic hamstring curl. It's going to be similar in nature, and we'll look at a few studies that demonstrate theoretically why implementing reverse Nordics might reduce your risk of rectus femoris strains. Nice reviews of eccentrics can be seen in Suchamel et al. In 2019, titled Implementing Eccentric Resistance Training. The eccentrics essentially are an active lengthening of muscle tissue against an external force or load, body weight in this example. They produce relatively more force than an isometric or concentric. They might help develop more sarcomeres in series, which has implications for shortening velocity and power output. They can help make the muscle tendon unit stiffer, which is a good thing, and there are other benefits. Now, there is a study by Alonso Fernandez et al. In 2019 that looked at changes in rectus femoris architecture induced by the reverse Nordic hamstring exercise. They had 26 men who had never done this exercise before perform the eccentric reverse Nordic. They had no injuries, and they showed some beneficial adaptations. They had increases in fascicle length, pennation angle, cross-sectional area, and muscle thickness over the course of 8 weeks. Now, the 2 biggest concerns with eccentrics are muscle damage and delayed onset muscle soreness. Luckily, a study by Chen et al. In 2011 compared eccentric exercise-induced muscle damage among 4 limb muscles. The quads actually showed to be less susceptible to muscle damage secondary to eccentric contractions, and this might be due to their higher exposure on a day-to-day basis and just their general muscle architecture. So let's talk about how to do eccentrics. Once again, if you don't feel comfortable doing this, start with the isotonics or isometrics in a shortened range of motion. But as I mentioned in the study, 26 men did this over the course of 8 weeks, having never done it before and had no injuries. You want to lower yourself as far as you can before failure to really challenge the quads. So I'll demonstrate. I'm gonna set up, make sure I'm in that nice straight position, and I'm going to lean back as far as I can go until I can't go any further. And let's say I could drop to my hands and reset that repetition. So once again, I'm going to lean back. I'm thinking about pushing my feet into the floor, go as far as I can comfortably go until I fail, and then drop down while still trying to maintain that shoulder, hip, and knee position throughout the entire repetition. In terms of programming, in one of the previous studies that we looked at, over the course of 8 weeks, they increased from 2 days a week to 3 days a week, from 2 sets to 3 sets, and then from 6 repetitions up to 12 repetitions. They took 2-minute breaks in between each set and 48 hours in between each session. Now, if you're in season, you probably wouldn't include this much volume. This would be better off pre-season. However, you do have to continue performing the exercise to maintain the adaptation seen. So you would still want to perform it in season, but probably just less overall volume. Well, I hope you enjoyed this video on reverse Nordics, how to set up, perform, and program them, 2 reasons why you should be programming them, both to increase strength and hypertrophy of your rectus femoris and to reduce your risk of injury while doing activities like sprinting and kicking. If you enjoyed the video, please hit that like button, subscribe, and let us know what else you want to see in the future by commenting below. If you want to see more content from us, head over to e3rehab.com. You can see our blogs, our podcasts, and other content as well. Thank you for watching. Peace.